Hello, everybody, and welcome back to Lit Minds. This is our second last session of the Lit Minds summer series, and we're really delighted to have everybody here. I'm Jeanette Bruce from Whistler Public Library, and of course, I'd like to thank our partners on this event. So Lit Minds is presented by the Whistler Youth Center, Luna Whistler, and by Whistler Public Library. And these last couple of sessions and our next session will be sponsored by the wonderful folks at the Whistler RCMP. We have a great guest for you tonight who I will introduce in a moment, but I just want to let everybody know that there are a couple of ways for you to interact with us tonight. So we are live on YouTube, and of course, if you're watching us there, you'll see that there's a chat box and you're welcome to ask questions there, and we will answer them during the session. If you don't have a Gmail account and you can't comment on the YouTube video, your other option is to use Slido, and it's a totally anonymous platform, so you can submit any question you'd like for our guest, knowing that you will be totally anonymous. I believe the Slido link is in the description of the YouTube video, so you can find it there. So 2 ways to submit your questions. We hope you will send them our way because we'd love to answer some of your questions tonight. Just to let you folks know, our last session, which is coming up on August 18th, it will be with folks from the Whistler Community Services Society. They're so wonderful, and we have mentioned them many times over the last several months, and you will get to meet some of them and hear about some of the services that they offer. So that's in 2 weeks' time on Tuesday, August 18th, same time, same place. So we hope to see you there. Now, we are joined tonight, of course, by our regular host, Greg McDonnell, and we are also joined by a special guest, Dr. Teresa Wood. Has been practicing medicine for a very long time in Whistler. I have her Instagram profile here right now, and and she describes herself as studying holistic medicine, sexual medicine. She's a sex and intimacy coach, and she's a speaker / author / poet. How well-rounded. Before I pass you all along to Dr. Teresa Wood, I just want to express my gratitude that we are able to gather tonight on the shared traditional unceded territories of the Squamish Nation and the Lil'wat Nation. We're very, very lucky to live, work, and play on these territories. And hey, if you're watching from somewhere else, why not let us know? What territories are you on tonight? We would love to celebrate that. Okay, Teresa. That's it for me. You can take it away.
All right. Thank you so much. Thanks for having me. I've been in our community for, I think, almost 10 years now, worked in a couple of the medical clinics and also the hospital, of course, keeping our people alive in the middle of the night. And I am here tonight to talk a little bit about mental health and physical health. I think sometimes people get confused about what they can go see a doctor about. And now I'm a family doctor. I do emergency medicine. I do sexual medicine. And as we were talking about, I also am a sex and intimacy coach for couples. And that's a little bit on the side. That's what I did before I was a doctor. So I continue to do it because I love it. But tonight, since we're talking about the mental health side of things, I just want to re-explain to people what we can come to doctors for. So doctors are trained in physical and mental health. The only reason people think there's a difference, in my opinion, between physical and mental health anyways, is because Descartes, who is a philosopher in, the 16th century or something, I might get the century wrong, he thought there was a difference between the mind and the body and that they were 2 distinct things. And so since then, because it fit well into our religious beliefs at the time and well into our psychology, we always thought that there was this thing called the mind and this thing called the body, and they were different things. Scientifically, the mind seems to be, more and more as we study it, just a physical organ. The brain is a physical organ that really does affect a lot of our mind, and our heart and our mind are linked in many ways. The things we call heart things seem to be coming mostly from the brain. And really mental health issues are physical issues in many cases. So we want you to know that if you are feeling anything that, if you break your arm, you come see a doctor, no one questions that. Your heart's beating funny, you come to the doctor, no one questions that. Um, but if you are feeling like, I just don't really feel like being alive right now, I don't know why, I can't get anything done, I don't know, I can't think properly, or wow, since that concussion a year ago, my life's just been a mess. But I don't want to trouble my doctor with that. No, no, no. The brain's probably your most important organ. It runs all of your body, it runs all of your functions, it runs your heartbeat. So if you're going to see a doctor because your heart's beating funny, you better darn well be willing to see us if your brain's beating funny. So doctors can help you determine if the way in which you're feeling is something that you can go talk to a counselor about and help sort through, or if it's something that really all the counseling in the world may only help this much with if you don't get a little bit of help from the medical world. So we very much welcome you to come and tell us, wow, a year and a half ago, I lost my dad and I have not been able to function since. I'm not really coping. Not coping is a great reason to come and see someone like me. So I'm going to touch on a few things that I think are important reasons to go see a doctor in the mental health realm. And please never think that you're wasting our time to tell us about matters of the heart or matters of the mind, whatever you want to call it, matters of the spirit. I don't care. It is just as important to me as sewing up your arm if you've cut it. Okay. So, and we do take it very seriously. As a matter of fact, mental health issues do kill people, and we will talk about how that happens in the next 20 minutes as I talk about this. But the first thing I want to say is people get a bit confused between psychology and psychiatry. So I'm just going to try to clear that up for a second. Psychiatrists are people who have been through medical school and then they learn about the ways in which to help the brain function better from a medical perspective. So a psychiatrist is someone who is a doctor who does psychiatry, and a psychologist is somebody who has not done medical school but has trained for a very long time to work through issues with people, either through therapy, cognitive behavior therapy, emotional therapy. There's all these different avenues they could use, and usually they have a doctorate in that. And a counselor is somebody who also does the same kind of work as a psychologist, but may not have done the entire 4 years of training to do that kind of work, but often with many years of experience can be just as excellent. So the reason I want to distinguish that is because sometimes if you're having a very hard time coping with something and you're talking to a counselor or psychiatrist, or psychologist, they may say, I want you to see your family doctor because I feel like though all the things we're talking about are good things to talk about, I'm a bit concerned that when you go home, you're not able to retain this, your brain is functioning at a level that needs a doctor to just do an assessment with you. And the reason that happens is because either genetically or because you've banged your head really hard a few times, or because you've used some drugs, street drugs, something or other, or because it just so happens, there can be some rhythms in your brain that stop functioning in the way that has you feel like a human ought to feel on a regular basis without help. That becomes serious if you get stuck, like feeling too anxious to leave your house, or not wanting to go to parties, not wanting to show up at work because of anxiety, or so flat that you can't get off the couch, or you just don't like life as much as you used to. Wow, I really used to like to go skiing or hang out with my friends, but I just don't really want to go anywhere anymore, and I don't know why. Those issues should probably be run past a counselor, a psychologist, or a family doctor. And your family doctor team is here for you. Like, we will sit there and hear what you have to say, and we will ask you the questions we need to ask that will help us understand, is this a genetic problem? Is this a head trauma problem? Is this a sexual or physical abuse problem? Or is this a sexual orientation thing that we just want to talk to you about? Or is this a gender orientation that you might need to talk about? So many of these things can be solved with talking, and many of them need a little bit more attention. And doctors are trained in determining which one is the one that you need. So sometimes I'll be talking to someone, and the first thing they'll say is, I don't want to go on medication. I just want, here's how I'm feeling. And they'll tell me how they're feeling. And then I'll say, yeah, why don't you go see one of the incredible counselors we have in Whistler and talk through some of that stuff. Some people will come because they've been seeing a counselor for many months, and it's just, they just aren't retaining it. They're having a hard time, and this can happen. So, for example, you can be talking to a counselor and get such a good feeling when you're there, and then you go home and your partner says, how did it go? You're like, oh, really great. What did they say? Can't really remember. Well, memory is part of the functions of your brain, and your brain functions, if they're all flattened at the same time, that's what we mean by depression. We don't mean sadness. We don't mean grief. You're allowed to be sad and grieving something, if a loss of a pet or a partner, a breakup in a relationship, a change in the job, COVID, you're allowed to be grieving things like that. But if you start to feel like you can't think, you don't really want to eat, or you're eating way too much, all you want to do is drink alcohol or do some drugs, or all you want to do is sit on the couch and just do nothing, like that is a flatness, and we call that a depression of your central nervous system. And what we mean by that is at the cells where the brain's telling this cell is trying to tell that cell something, there's a junction. And at that junction, if the message isn't able to cross properly, you get all of the functions of the brain flattened. And when they're all flattened, you don't feel very good. As a matter of fact, one of the brain's functions is the desire to be alive, because we're created as animals that want the species to propagate and want to be alive. So if your sex drive's down, if your desire to be alive is down, if your desire to go skiing and mountain biking is down, if all those things are flat and you're not feeling motivated, your entire brain may not be communicating at the right speed. If you have a family history of that, then you have more of a chance of getting something that might need some help. And as I say to my patients, people say, I just don't want to take any medications. And I understand that. And nobody's going to pressure anyone into taking medications. However, if your heart's beating funny, and your heart beating funny could possibly cause you to die, we wouldn't discuss whether or not you were taking medication. You would just be like, yeah, give me that. I don't want to die. So if your depression or anxiety is at the point where your drive to be alive is flattened, now we got a medical emergency. And that's why we say, if you ever feel like hurting yourself or thinking about hurting yourself, pick up the phone, call 911. We are not kidding. We are here for you. We want to hear about it. Okay. And we will see you for suicidal thoughts at any time, any day, in the middle of the night. It doesn't matter, because that is your brain functioning so flatly, it forgets that our natural drive is to be here. Okay. So, I've talked a lot about depression there. Same thing, anxiety, like constant overwhelm. I can't cope with everything. I can't think straight. I'm having a hard time like putting my thoughts together. I start a conversation with a person, then I'm thinking about another thing, attention deficit. I've got voices in my head that are telling me to do stuff that I don't really want to do. Please don't be embarrassed to tell someone that. Those are medical problems that we need to hear about so we can help you. And that's what family doctors can do for you. The emergency doctors can do that for you. We will listen to what's going on in your head that is having you want to hurt yourself, hurt someone else, isolate yourself from the world, not cope at work. Any of those things, they matter to us. Okay. So I hope I'm making that really clear, because it's super important. Sexual abuse is something we don't tolerate, and we will help you get out of situations where that's happening. power dynamics that are threatening your well-being, those matter to doctors. We can help you sort through that. We can find you the social worker or the counselors. Domestic violence, you got to talk to us. We try to put signs everywhere, but we don't need you to be in situations on your own without professional help, and we want you to access us for any of those. The other little piece, because I do a lot of concussion work, is just a reminder that, you know, people think concussion is you bang your head, you may or may not go to the hospital, you may or may not lose consciousness, and you're probably going to throw up, and you're probably not going to watch screens for a while. That's going to help you get better. It kind of depends what part of your head you hit, whether or not you're going to throw up. Obviously, if there's entire swelling of the entire brain, it will also hit your vomit center. But it is possible to get depression without ever throwing up. It's also possible to get attention deficit as an adult if you've hit your head once hard or several times not as hard. And so if you're in a post-concussion syndrome, it would be wise to talk to your family doctor and say, you know, I listened to Dr. Wood talking online about concussion, and I feel like, yeah, since I hit my head 6 months ago, I haven't really had desire to be alive or participate in life the way I used to. Like, is there something we can do about that? Because often there is. So I really want you to know that concussion stuff that hasn't gone away after 4 or 5 or 6 months should be readdressed by a family doctor or a neurologist or a psychiatrist, whether or not it's contributing to your mental health issues. And last but not least, we're in Whistler. Many people have come to Whistler to have a good time. You know, I always make the joke, like helmet, 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 like wear, you know, protection on your head, wear protection on your penis, like make sure that you're protecting yourself when you're out there playing. But also, one of the big things I see in Whistler is addictions. And I want to talk about addictions for a second, because party drugs are super fun. And we know people come to Whistler to have a good time. The problem is, you take 5 people and they all go out to party and they all have a good time. One of them might have an underlying mental illness they didn't know about, or a family history potential. And all of a sudden that person, everyone else went out and got high, and that person went out and felt normal. Now we've got a different situation. What's probably going to happen, and I've seen it over 100 times, is those 4 people are going to go home and sleep and say, whoa, that was fun, but I'm not going to do that for a really long time. And that person's going to go, oh my goodness, I functioned for that whole night. I could talk to people. I wasn't freaked out. My anxiety was almost zero. And I had I didn't have like a woohoo good time, but I functioned. That person is at extremely high risk for addiction, and I'm going to tell you why. That person just got treated for something they weren't getting treated, and they had one night of treatment from a street drug. If you see where I'm going with this, that means they think that if they had that again the next day or the next day or the next day, they could function better. And guess what? They're kind of right, except that the street drugs are very dirty, very poorly dosed, often dispensed by people whose goal is to make money off you by getting you hooked. And those people are extremely high risk. And guess what happens? Those 4 people start to think, oh no, that guy's weird, or that girl's weird, and she's just doing way too many drugs. I don't want to talk to her anymore. Oh my God, we just want to do it one time. The problem is that person needed to go see a doctor, and those people went partying with them. And those people could say, hey, buddy, sweetie, friend, person, I think we need to talk. I think those drugs that you're taking are helping you with something. And probably a better source for those drugs might be a doctor who understands and isn't giving you the ones made in someone's bathtub. Maybe we should go to Whistler Mental Health and talk about what's happening. If you have a friend that you partied with who is now getting deeper and deeper into partying in a way that you think looks a little uncool, consider that they have a mental health issue that they're accidentally treating with street drugs. And they are at a very important time for you to grab them and save their lives. So I just want you to know those people should also come to a family doctor or to Whistler Mental Health and say, hey, I heard Dr. Wood talk. I've been kind of using a lot more crystal meth than I meant to. And we're not going to be like, oh my God. We're going to say, okay, great, great. What do you think you're treating? And you're going to say, I don't know. And we're going to say, okay, let's talk. And we're going to go through the list of questions that we need to go through to sort out what it was that you brought to that party that accidentally got treated by whatever you took. And we're going to help you figure out the safe way to get that under control. Okay, so it's super important because people tend to leave their friends who get addicted behind. And really, if your friends are getting addicted, they need you more than ever, and they need you to bring them to the family doctor. Our job, we're not the police. We're not going to take your jobs away. We're not going to judge you. We have dedicated our lives to making people well, and we understand that people get unwell for lots of complex reasons, and we're here to help. Okay, so hopefully I've covered a bunch of things. The last thing I just want to say is obviously COVID has completely changed the face of medicine for all of us. Doctors are, we're struggling to figure out how we're going to see people. As many of my patients know, Coast Medical has closed. Northlands had closed not long before. We're down to Town Plaza and Whistler Medical Clinic for family practice access in Whistler. Don't panic. I know we had a doctor shortage before, but we also have a people shortage right now in Whistler. So it's balancing off. There's no panic. There are doctors who are available who would love to see you. Typically, we're trying to see as many people online as possible because doctors need to stay safe. People need to stay safe. So whenever possible, we're seeing people first online, often just on the phone, and we'll sort out what you need. If we think you need to be seen, we'll tell you that. Or if you think you need to be seen, you tell us that, and we'll arrange for where you can go. If you're a Whistler Medical client, you can call Whistler Medical and set up a phone conversation at any time. And again, mental health issues count. The brain's your most important organ, so make sure that you're getting it attended to. If you're from Town Plaza, same thing. You can call Town Plaza and make an appointment. If you don't have a family doctor, like 50% of Whistler. If you're my patient, you can reach me online, Dr. Teresa Wood. You can find me on Facebook or Instagram and contact me, and I will try to help you get sorted. If you're a Coast Medical patient who wasn't my patient, who was a Coast Medical patient, unfortunately, because it's closed, the access is more challenging. You can do online consults with the Vancouver doctors. But if you'd like to stay in Whistler, which we always recommend being with a doctor who's in the same town as you in case you need a physical exam, then our invitation is to use the telehealth platform that the government has put out to help you. And I think they're posting it, Jeanette, on, yeah, okay, so that will be posted so you can click on the link and make an appointment and see a doctor via telehealth. It will be one of the doctors from one of the clinics, and they will decide if you need to be seen in person. So hopefully I've covered a little bit about the things that would have you want to come to a family doctor. It's a great starting place. You can go to Whistler Mental Health, you can go to Whistler Community Services, you can call the counselors directly, or you can get in touch with the family doctor clinics, or you can go to the emergency room if it's really, like if you're feeling very overwhelmed, especially please, 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 if you're feeling like hurting yourself or anybody else, that is like the most important reason to come talk to us. We are not going to judge you. We are going to help you. Okay. So that's where I'll stop for now. And then if anyone has questions for me or anyone else, or any of the moderators want me to talk about something else, just let me know.
Well, thank you so much, Teresa. I have approximately 1 million questions for you, but I think seriously, if people who are watching, if they take away one thing, I think that your last point about if you have a mental health emergency, you are allowed to use 911 and you are allowed to visit the emergency room.
100%.
That, I think, is such a valuable takeaway, because if you're in that state, you're probably not in the state to Google like outreach worker, Whistler Community Services. You know, you're just not in that headspace. So the fact that you can call 911 or go to the emergency room, I think that's such a valuable message. What I wanted to ask you, I have a big list here, but what I wanted to ask you about, so I loved your take on the fact that young folks or folks of any age who are using street drugs may be medicating themselves for an issue they didn't know they had or had not acknowledged yet. And what occurred to me was, it's so interesting that there's probably more stigma around prescribed drugs for mental health issues than there is stigma around street drugs in this town. Can you speak to that?
Oh, that is such a good point. And really, full disclosure, I kind of went into medicine because I was a little bit skeptical about doctors myself. And I thought, I'm going to go in there and change the whole thing. And I'm skeptical about medication, which is kind of why I'm known as the hippie doctor, which wasn't a name I gave myself. I just ended up hearing that was my name. But I understand people's concern about the pharmaceutical industry, and there are some issues, and there are no free lunches, and we are, only able to study things that look a certain way. However, we are also unable to put out false truths, whereas a street drug provider can put out any false truth they want. And we don't have, so I think one of the misconceptions about doctors for many people who are concerned is that maybe maybe they forget that we went in because we care about people. Like, most of us didn't do 8 years of school because we like to squash people. Most of us went to school because we love helping people. And so we've dedicated our lives to that, and we do have a lot of really important tools. And I think the mental health medication thing has come because it's very hard to research mental health things. I mean, what we have is what people say, right? As opposed to when you're doing, blood levels of this or that, you can like measure it exactly and understand, or blood pressure. Okay, this medication brings it down 10 millimeters of mercury, like consistently every time in 30% of the population. Like, those are really easy things to study. It is quite complicated to study things like birth control, for example, and which is why when someone comes in and says, hey, I want to try a birth control pill, we're really just trying. And there's going to be some that are awful in some women's bodies and some that are great. And really, every woman's body is going to be a bit different. So it's a bit of a trial and error in some cases. And unfortunately, mental health is a bit like that too. Now, we have categories of medication where, like, we understand once we have a good solid diagnosis, this person has depression, this person has ADHD, or this person has psychosis. Yeah, we have categories, but the way each medication functions inside any particular brain or body is going to be different. So it is a little bit of a hard time trying to sort out what's right or wrong. The same is true of street drugs, obviously, but the street drugs are all in the category of like hyper, make you feel good, make you party medications. And they're giving dopamine or monoamines or whatever to the brain to make the person more alert and awake and wanting to dance all night and feel good. So that category of medication is like it's very tempting for people. It's a very pleasurable thing. Whereas, if you're trying to bring someone's mania down so that they don't hurt themselves because they have far too much endorphin at all times, and they're unable to stay focused and calm down, or not feel like they could fly and therefore jump off a 3-story building, those medications bring someone down and they're less appealing. Obviously, our job is to keep people as safe and as happy as possible and as able to function in the world. So, and then you're asking a really good question, like, why do street drugs not get the stigma and medications do? Um, I don't know, Greg, do you have anything you want to say about that?
Yeah, I did, and I was just sort of putting my hand up there virtually, but I think I've come to learn that drug use in general has there's a culture of acceptance around it let's say in the Sea to Sky corridor, or just in our space and time in the universe right now. There's a real culture of acceptance around that use, and um, there also appears to be a lot of social capital if you're part of the crew that's down. You know what I mean?
Mm,
And so for new people perhaps arriving to Whistler and trying to find their people, they want that social capital. They want to find like-minded people. And I think that, along with, I think, numbing behaviors, tend to be like a pretty desperate recipe for that use.
mm, thank you. Yeah, that's great. And what would you say about like the stigma around mental health is, I mean, my feeling is that people think of mental health as a different thing than physical health, and that's a very old school idea. Again, I think from the time of Descartes, where we didn't understand it, and because it manifests with words and actions, as opposed to blood pressures or heartbeats, we have not gotten comfortable with it. Whereas it's just as important to treat it, and just as important, almost more important, since the brain runs our entire body, to be in balance in our psyche. Why do you think people aren't seeing um, the balancing of the brain waves as an acceptable thing to see someone about?
Yeah, I'm not sure. I mean, I think we are doing quite a bit better job as a society dealing with that stigma. So I think we are seeing more normalization of talking about it, more people coming forward. And I like to reference that sort of Bell Let's Talk campaign,
Mhm.
which really gets people talking every January about mental health and that stigma, and trying to reduce the stigma. Of course, in our Sea to Sky corridor here, we have a lot of activity happening around investment in this, whether it's the Kelty Patrick Dennehy Foundation or the Zox Foundation or the Cats Amsterdam Foundation. We're really kind of, shining a light on it in our corridor with the hope that that stigma continues to be reduced.
Mhm. Mhm.
Greg, can I jump in for a second and ask you, I know we've talked about it in past weeks, can you explain what social capital is to our viewers?
Yeah, it's sort of the unspoken commodity, I guess, of things that's going to make you socially fluent or socially adept at being able to navigate your area. And how we behave as a society is different from one community to the other. And I think we'd all agree that how we behave in the Sea to Sky corridor is wildly different than other places in the world. And that's why, and I've always believed that the corridor has attracted some like-minded people. We're adventurous, we're entrepreneurial, we're risk takers to a degree. But there's also a segment of us that are maybe running from something, right? And so we've all kind of found our way here because the social capital of the sort of the corridor, to a degree, and again, this is one lens, it's not the lens, but the social capital sort of welcomes people, and so people tend to find roots in their identity there. And as soon as that identity structure gains a bit of foundation, it's like, okay, I'm worthy, I'm safe. And sometimes that sense of worthiness is often found in external validation, which tends to make us powerless, tends to make us victims. And a lot of the work with people kind of coming out of maybe having some seeking misguided social capital is about gaining their power back and getting some sense of empowerment, that actually their worthiness comes from them.
Mhm.
And so they don't have to go jump Air Jordan if they're not ready to feel worthy, because they're already worthy, deeply worthy of love and belonging in and of themselves. And so I think that's a real big transition to make around seeking this sort of external validation of worthiness through social capital kind of means, what's happening in my society that's going to make me fit in, and really work to try to find some internal validation. And we see those people around, doing things a little bit differently, courageously, and I just love seeing that.
Mhm. I just wanted to pipe in there too about you're touching on something that I teach a lot, which is about sexual safety, and I think a lot of young women, especially, they don't know what they want sexually. And what they do is they take alcohol or drugs or whatever, the social capital thing, and they provide sexuality to other people because they think they're supposed to. And one of the things I try to teach young women is what you really need is to find your own sexuality and learn how to make love to yourself, because they say you can't love someone else unless you unless you love yourself, which isn't actually true. Women are very good at loving other people and not themselves, and I don't recommend it. I recommend that you know how to love yourself and that you know how to make love to yourself, because if you don't know where your clitoris is, for example, if you don't know how to touch your own body, how are you going to tell anyone else? And if you think it's all about this intercourse thing that everyone else is going to try to take from you or have with you, then you're not going to know anything about the outer course, which is your access to pleasure at your own brain's reward center. And I think it's so important for women. Like we won't even talk about masturbation, but we ought to, because it's actually a good way to be safely sexual. And I tell young women, like, look, maybe instead of getting drunk and ending up with people and not remembering who it was, and then not sure if you even consented to what happened, why don't you make love to yourself 20 times, find out what you like, and don't be with anyone who isn't providing that. And why don't you try doing it sober, because you might actually really enjoy being present for all of that. If you're too scared to be present, then maybe it's not something you need or want. Maybe it's something you're providing for that kind of social credit that Greg is talking about. And you don't need to provide anything to anyone for that. What you really need to do is respect yourself and protect yourself. When we were growing up, Greg, I don't know if you remember those ads, but respect yourself, protect yourself was like the whole thing. And it was all about wearing condoms because we're only allowed to talk about intercourse. But I like to talk about outer course, and I like women to get their pleasure. And I like young women to know what their pleasure is before they go satisfying other people's pleasure or thinking they're supposed to. And I think it's really important because it would save a lot of STDs that come into the clinic, and also STDs like, and I don't even remember what happened, and I don't know if I'm pregnant or not. I don't even know if we had intercourse. And so I think when young women are empowered by their own sexuality and they found who they are themselves and what their bodies like, they can find out that actually you can have a lot of great sex without intercourse, and then you don't have to worry about all that other stuff. And then you're actually getting something that our generation almost never did, which is equal opportunity orgasm, which is, and possibly a way lower risk for STDs, and also for pregnancy, and for other concerns that would bring you to the doctor. However, if you're having those concerns, please come and see us. A lot of people are shy to tell us that something's going on. They need someone to look at it. It's our job. Okay. So come see us.
Greg, did you raise your virtual hand there at some point?
Well, I was just going to say, I think that's, thanks for sharing that, Teresa, and I like the concept of outer course in the sense of, you know, um, making love to oneself in a conceptual sort of way, just to get to know who you are, because I think it occurred to me that might save a 10-year journey of building your sexual identity on something that you don't even identify with.
Exactly.
On something that somebody else is projecting onto you, or society's projecting onto you with that social capital. And I think that's a lovely sort of growth area for someone to derive their own identity structure internally.
100%. I think self-love in the metaphorical sense of just being able to love yourself and appreciate what you have going for you as a human being, and self-love in a sexual sense are probably two of the biggest tools a person would have for coming into society and sorting out where they're at. Now, if you've had like an abusive upbringing of any sort, sexual, emotional, psychological, spiritual, or physical, it can be hard to find a place of self-love. And that's what the psychologists and counselors can be helpful with, or someone who does sex therapy like myself, if it's a sexual trauma, or if you have an addiction to sex, like these are things that people are so ashamed about, and you needn't be. We consider them normal variations of something you should come talk to us about. So I think if we could dispel the shame and move back to the self-love and just say, you know what, I should feel well, I don't feel well, and maybe there's someone I should tell.
I want to run with that idea of dispelling shame and embarrassment, and go back to something that you said right at the beginning, Teresa, which was you said, if you feel sad, you can talk to a doctor. If you're grieving, you can talk to a doctor. You can be sad and not be depressed. You can be grieving and not be depressed. You can be any combination of those things. But what I'm wondering is, do you think that when it comes to being treated for mental health issues, is there shame around the potential diagnosis? So having somebody tell you you have depression, clinical depression, do you think that's a barrier to people coming to see you?
I certainly think that's a barrier. And I think that barrier is slowly being lifted, as Greg said, by some of the initiatives that are going on social media, in our community, and everywhere we can. Because as you can see, anyone who knows anything about it completely disagrees with the general population's stigma that's there. And we're not even 100% sure why it's there. But what we do know is that it oughtn't to be, because they're not, nobody wants a diagnosis of anything. You don't want to be told that you have a tumor in your abdomen, and you don't want to be told that you need to take a medication for your heart, and you don't want to be told you need to take a medication for your stomach. Really, we want to be well. I think when, for some reason, with the mental health diagnoses, people think, oh, everyone's going to think I'm crazy. And it's like, well, actually, that everyone, probably like 30% of them are on some of these medication. And like, so is that lawyer, and so is that accountant. And why do you think he finished school? Well, probably because he took the medication that allowed him to think through those exams that he couldn't think through because he had an attention deficit, and he was looking at the flies on the ceiling instead, and the exam time was over. So there are so many more people whose brain function can be improved by either psychological training with a good psychologist or counselor, or unlearning of old bad habits, especially those of beating ourselves up on a regular basis, which like a ton of people in our society are quite addicted to. We wake up in the morning and the first thing we say is, oh, I don't like where I'm going. It starts off like that, like, hi, me, I love you. How about that? Like, nobody starts that way, right? So there's so much we could do in our psychology to improve it. And are they linked? Well, 100%. Like, some things you can work through, but I often bring up like a young patient of mine who came in with an adult, and the adult was saying, well, we've seen 3 psychiatrists and they all say she should be on medication, but we don't want her on medication. And I say to her, well, what do you think? And she says, well, the next person who tells me to chin up and just smile about it, I'm probably going to punch them in the face, because whatever's going on in their head might be okay, but what's going on in mine never is. And I can't chin up. And I've been trying for 3 years. And I say, well, how do you feel about taking something that would help you with that? And she's like, yeah, like, bring it on. If you have anything that could get me out of this, So often there are people who wish there was a solution, but they think it's bad to ask, or they think it's bad to have a diagnosis. Like, you don't have to tell people what your diagnosis is, but it helps other people come tell us, right? And you said you can talk to your doctor about grief and sadness, and that might not be depression, but the other way around, you can be completely depressed and not one bit grieving or sad. And that's the other thing. Like, often depression is this complete flatness, emotionless thing where you just like, I just don't feel anything. If you don't feel anything emotionally, then maybe your brain's not allowing you to feel, and you actually would benefit from that. So flatness is also a sign for someone to come see us. So I don't know what to say to that stigma, except it's the same thing as like you're not allowed to touch yourself sexually. All right. Like that kind of stuff, it has gotten nobody anywhere good. It's time to just quit it, because that's the kind of stuff that perpetrates the status quo, which benefits all the people who um, are in a position of privilege about that. But those who actually need the attention, or those who aren't getting their sexual pleasure, or those who aren't getting their needs met in a mental health thing, and can't function, well, what benefit is it to you to listen to a whole bunch of people who are wrong and have an opinion that nobody who has studied anything agrees with, that keeps you away from coming to us and saying, hey, like, whoa, I got a solution for that. You want to try it? And this solution I'm going to monitor you for, because I think another thing, people are like, oh my God, I'm going to get side effects. Well, so I want to address quickly side effects, and also like people are worried about getting addicted to the mental health medication. So I just, those two things. So side effects frequently, um, there's two kinds of side effects that I think need to be addressed. One is the kind that kind of go away in the first week of taking something. So when you take something new, your body has to adjust to it. And especially with antidepressants, a lot of people feel that initial nausea and grossness, and they're like, oh, I can't take this. And I say, well, look, if you can get through the first week of nausea, I got through 9 months of nausea with my twin pregnancy. So I'm pretty sure most people can get through a week. I was like literally crawling from toilet to bucket and eating my food by the toilet bowl. So I'm pretty sure most people can get through 1 week of nausea. And if it's still there after a week, then we'll switch you to something different. But that initial nausea is normal, because guess what? You have a nausea center in here, and you are messing with that in a little bit to get your brain cells to talk to each other better. And in order to do that, you're going to have to go through a couple adjustments, but guess what? You can adjust, So those kinds of side effects that kind of go away in the beginning are one thing. And then there's like bigger side effects that are a little bit more long-term. And people will say, like, what about the sexual side effects? And so a lot of those side effects are addressable by either a psychologist or a sex therapist, or someone who can help you through those things. And there are ways around those kinds of things. But yeah, if you're changing the way that the brain is functioning, there are sometimes side effects, and people worry about that. We find the medication that is going to work best for you slowly over time. As a team, you're the main person, and we're the expert advisor, and you're your healthcare provider. And you sort out, you say, hey, this made me feel great in this way, but then I got that. And then we talk about, oh, okay, well, then that's not the right medication. I got this other one, and let's try that. So we can work through a lot of the different side effects. In terms of addiction, it's the same thing I say to people about the heart rhythm issue. Like, yeah, are you addicted to the heart medication that is keeping your heart beating in a way that isn't going to drop you dead on the street? No, I don't think addiction's the right word. I think you're on a medication that you need to keep your heart functioning properly. Being on a medication that helps you make your brain function properly would be almost more advisable, because again, your brain runs your heart and all your other organs. And it's really reasonable to be long term on a medication that makes you feel wonderful compared to the absence of it. So it's not an addiction if you still need it. If you're just going through a tough time and you're going to use it for a certain period and then come off it, it's not that hard to do. You just shouldn't do it without a doctor's advice. You should always do it with them. The mistake people make is they go cold turkey off a medication, or they just forget to refill it and the doctor's office is closed and they can't get their medication, and bam, they go through withdrawals. Yeah, that's not right, because your brain didn't expect to slowly titrate up safely with the doctor who's monitoring you at every step and then all of a sudden, bam, off. That's not what your brain wanted. So what your brain wanted is to, once it's safely at the top, at the dose it needed, and then things change and you don't need that much anymore, or you did your cranial sacral, or you did your osteopathy, or whatever, you worked through your concussion symptoms settled down, or your life settled and you don't have as much to worry about, or you've got this brand new job that doesn't have an abusive boss, whatever it is that helps that. And then you can slowly come down with the care of a physician, and then you get to here and you're like, oh, okay, that's enough. Actually, I like this one better. I'm going to go right to there. That's not an addiction or a dependence. That is an ongoing need for treatment to keep that cell communicating with the next cell at a rate that makes you feel like a healthy human. There's nothing wrong with that, and that's not a dependency. That's a treatment.
Craig, did you want to jump in?
I just wanted to add one thing to that I think there's some great research out there that's suggesting that the medication in concert with the psychotherapeutic treatment actually increases the efficacy or the chances of good positive change. So often the two work really well together.
And also, may I add to that, because I totally agree, physical exercise, healthy diet, reduction of alcohol use, and normal sexual function, making love to yourself, are all things that feed the brain the things that it needs, that keep a normal, healthy balance. So, sometimes if you've been depressed for a long time, you've completely forgotten about the need to eat well and to not drink and to, all these things. And I don't mean, never drink again, but what I'd like to remind everyone is like the planet made water for our survival. Like, we're all animals here, let's face it. We like to think we're a little bit special because we think. I think it just makes us a little bit weird. But the planet made water for our survival. We modified it to make it addictive because that makes us a lot of money. That doesn't make it good, okay? It makes you able to drop some filters and dance more if you're shy to dance in front of other people or whatever. But what it does is actually a central nervous system depressant. So it's actually over time depressing the ability of your cells to communicate with each other at that gap junction I was telling you about, where the serotonin needs to come through. And over time, you almost will develop a need for a medication to counteract that if you're continuing to drink at that amount. So what I like to tell people is like, I'm not asking you to stop drinking forever, but for every time you put like $10 into the pocket of a human, could you thank the planet for what she provided and have a glass of water? So have one glass of beer, one glass of water. It is almost impossible to overdrink water. You get this weird thing called satiation, which is satisfaction, which your brain says, that was good, I don't need any more. Like you get once you've had an orgasm. Girls too, the cuddly ones are probably not satisfied. So the satisfaction you get from a dopamine rush at your nucleus accumbens from a good glass of water makes you go, I don't know if I need much more. But alcohol has a special component that makes it like, I'm still thirsty, I still need more, I still need more. And you can actually drink way too much fluid with alcohol in it if you keep drinking. But if you have that little glass of water in between each one, you won't make yourself sick, and you won't necessarily be able to drink at the level that will allow your central nervous system to depress itself enough to need to be on a medication. So sometimes the first step is just acknowledging that, like, we probably don't have to hurt ourselves only. We could hurt ourselves a bit and then like health ourselves a bit. Just get the balance a bit better.
Teresa, we've only got a few minutes left,
Okay.
and I wanted to ask you a few questions ago, you referenced sort of a hypothetical patient who had maybe a parent speaking on their behalf. And when you finally got down to asking the young person how they actually felt, the whole story shifted. And I'm wondering if you can talk to us a little bit about teenagers accessing medical help
Oh, yeah.
without their parents or guardians
Right.
along for the ride.
Great question. Yeah. So the truth is that anyone is allowed to take care of their own body in British Columbia, and they're allowed to access any care they want. If you want to talk about sex, drugs, and rock and roll with a doctor, you contact the doctor's office, and we're not going to say, "Did your parents say you're allowed to talk to us about this?" And also, confidentiality is a thing. Our job is to listen to you, talk to you, and not tell anyone else what happened. You see me in the street after you've like bled your whole heart out to me, I'm not even going to say hi. And it's not because I don't like you. It might be because I've got two little 6-year-olds running all around me. But it's because it's not my place to let other people know that you've accessed any care from me. So we're pretty good at this. And actually, we're not going to tell anyone. And actually, in British Columbia, we aren't allowed to tell your parents, even if they ask. If you come and talk to us and you disclose something to us and you say, yeah, you can talk to my mom, we'll write that down and we'll say, okay, talk to mom. Can we talk to your dad? No. Or can we talk to your uncle? No. So we'll write down who we're allowed to talk to, and otherwise we will not talk. And if it's nobody, it's nobody. It's between you and me and the walls. And so that allows you to access mental health questions, sexual health questions, drug questions. And we will ask you questions about that sometimes. And you can just know that we're asking you for your health. I think a lot of people are shy to tell us if they're using drugs, but it's super important, because if we're giving you a medication, we better darn well know what you're taking. And if you drink a lot of alcohol, that's another thing. Make sure you tell the doctor who's giving you any kind of medication how much you're drinking, because sometimes doctors don't always ask that question, but even Tylenol can be bad for you if you drink a lot of alcohol. So you ought to tell us what your liver is dealing with on a regular basis before you give you something. But yeah, the in BC, it doesn't matter how old you are, you can come talk to us and we will see you. And we may say, hey, I think it would be a really good idea to bring your parents into this conversation. And you can say, well, that's great that you think that, but I really don't want that. And then that's it. End of story. So, but if you say, okay, well, can you tell them instead of me? Sure. Just tell me what you want me to say, and I'll tell them when they come in with you next time. And you can hear me say it so that it's not, you're wondering what I said, you'll hear it. So yeah, we can help you with conversations with teachers and parents and social workers, and we can help you sort out any problem with or without another adult there. Yeah.
Awesome.
100%. And if you're feeling like, just a quick other thing, like people do get into power dynamic situations. Like if somebody is telling you not to tell your parents, or if someone's telling you not to tell anyone something, a doctor is a very safe place to come and tell that too, because we know what kind of people would be telling you that, and we know very careful ways to get you out of a situation that you're in. We're professionals, and we have a good team of people who can help you. So if somebody is having you do something sexually or physically or do drugs or anything, and making you feel bad or making you feel like you shouldn't tell someone, that's usually a red flag. Someone says, don't tell anyone that this happened, come and tell me. Or your parents, if you feel comfortable.
Amazing. Well, it's 9:30. So I just wanted to check in, see if Greg has any last minute words he'd like to share. Greg, anything on your end?
Not really. Teresa, thank you for this interesting and far-reaching conversation today. I learned a couple things myself that I'm certainly going to take forward in my own world of working with people, and really value your time tonight and all that you bring to our community, and wanted to thank you very much for your contributions.
Oh, likewise, Greg. It's always great to hear you speak and teach and be the counselor you are in our community. It's great to work on your team. Thank you.
Teresa, would you like to tell the people at home about your social media work?
Oh, I could. Yeah, so for about a decade before I was in medicine, and I've come back into it, having just written a book about it. I do teach about sexual health and sexual pleasure, and just normalizing normal, healthy sexuality for all genders. And I do that on my social media pages. You can follow me at Dr. Teresa Wood, either on Instagram or Facebook. I'm trying to build a YouTube thing. If any of you know about social media and want to come help a poor doctor who doesn't understand it and could care less, but just wants to change the world, contact me over social media. I'm hiring. So yeah, it's just TERESAWOOD with DR for doctor in front of that. And my website's drteresawood.com.
Amazing. Well, thank you again so much, Teresa. This was really interesting, and I could talk to you for about another hour on this subject. And thanks again to Greg, to our team, our Lit Minds team, the Youth Center, Luna Whistler, Whistler Public Library, and our generous sponsors at the RCMP Whistler. We hope to see lots of you in 2 weeks' time, August 18th. We will be talking with the team at Whistler Community Services Society. And I think that's it from us. So good night, everybody.
Good night. Thank you.